Hi, I'm Tina Polish, your functional health coach. I'm visiting with you today about how to know its mold illness. Mold illness, aka chronic inflammatory response syndrome, or CIRS for short, is a multi-system, multi-symptom illness. It has obviously been around forever since the Bible talks about what to do in case of mold. See Leviticus 13:52 and other places. But people are just recently starting to realize again the applications of it. About 95% of the time, mold illness occurs in people who have a genetic sensitivity to it, about 25% of people. Because some part of the HLA-DQ-DR gene in the body has been turned off or on in a specific way, when they are exposed to biotoxins like mold, their body develops a chaotic inflammatory response. This response is not capable of removing the mold mycotoxins from the body. These mycotoxins from mold change hundreds of other genes to cause an avalanche of symptoms. Inflammation normally happens every day in our body to repair it from injuries. Things like when you hit your thumb with a hammer. This inflammation is venturing to heal the area. But in mold illness, that doesn't happen. It's so disorganized that it can't get the mycotoxins out. Put that together with the dysregulation of so many of the eliminative organs not working properly, and you have metabolic chaos. The most common symptoms of mold illness, and you should have most of these in mold illness, are fatigue and weakness in the body and brain, feeling unwell after exercise, disorientation and confusion, headaches or irregular body pains, vertigo, lightheaded, muscle aches, cramping, joint pains without inflammatory arthritis, hypersensitivity to bright light, blurred vision, burning or red eyes, tearing, cough, asthma-like symptoms, shortness of breath, chronic sinus congestion, air hunger or unusual shortness of breath at rest, chronic abdominal problems including nausea, cramping, diarrhea, or constipation, a propensity to experience static shocks, fast or irregular heartbeats, insomnia. It's also common for people with mold illness to become hypersensitive to chemicals of all sorts, get gut parasites and marcons, aka multi-antibiotic resistant coagulase negative staph in the nose, and hormonal chaos like circadian rhythm and sex hormone dysregulation, among others. More symptoms include an inability to learn new information, memory deterioration, mood swings, appetite swings, difficulty regulating body temperature, excessive urination, night sweats, difficulty concentrating, lack of focus, unusual skin, sensitivity, tingling, excessive thirst, ice pick pains, and that excessive thirst is, you really can't fix it by drinking anything. Abdominal pain, numbness, and metallic taste. You should know that if the mold count is high enough, it can lower protective hormones and cause mold illness even in the other 5% of people without the gene sensitivity. You can also get CIRS from a tick bite, exposure to contaminated body of water, eating contaminated fish, or in rare cases, a spider bite. Accidents, surgery, and extreme stress could also be triggering events. Are you blown away by the far-reaching scope of symptoms? You should be. As of now, it has been studied and proven that 1/3 of Alzheimer's has a root cause of mold. How is mold illness treated? The first step is avoidance of any ongoing mold exposure, which I will talk about in another video. I hope this is all, or I know this is all a little overwhelming right now, but please stay with me. I'll give you more information on what to do. Thanks for joining me. I would really like to see you get well. And I see you next time. Bye.